Good afternoon and welcome my fellow new nurses. My name is Tate Hebert and I would like to thank you for taking the time to join me while I present this training video on the importance of nursing sensitive quality indicators. I am a registered nurse and I work at a level 2 trauma center in surgery. I am also a member of the quality improvement team here at Ochsner Lafayette General Medical Center. I am delighted to have been chosen to be the speaker for this presentation. My enthusiasm is for the role, which entails overseeing Ochsner's medical information and technology quality, as well as continual improvement for patient safety. This audio presentation aims to improve your understanding of how the healthcare system uses quality indicators that are relevant to nursing. The focus will be on the significance of indicators, methods for gathering data, and the critical role that nurses play in ensuring correct reporting for high-quality results. Now that everyone is seated and comfortable, let's get started. Nursing sensitive quality indicators in NDNQI. The National Database for Nursing Quality Indicators is an essential tool for differentiating nursing across different unit classifications and emphasizing structure, procedure, and outcome. The publication provides information on recommended methods and the costs associated with achieving specific goals. Nursing sensitive indicators are defined as criteria that demonstrate changes in a patient's health condition that nursing care can directly affect. Staff nurses and unit managers collect data to determine how well they perform in evaluating patient outcomes. Hospitals use this data to set goals for organizational improvement at every level of the organization. The topic that is the focus of today's video presentation is sepsis. Organ failure resulting from an overpowering host reaction to an infection is known as sepsis, which is a medical emergency. Sepsis is unpredictable and can rapidly progress. In extreme cases, the heart rate drops, blood pressure weakens, and the patient spirals towards septic shock in as little as 12 to 24 hours. Once this occurs, the patient can go into multiple organ failure and die. The three main obstacles standing in the way of diagnosing sepsis: no biomarker has enough sensitivity, the condition is a diverse illness lacking a common origin or phenotype, and clinical symptoms are not specific. The patient could have an infection that is not improving with broad spectrum antibiotics that are often used at the beginning of suspected sepsis. Antibiotics alone are not effective in treating sepsis. IV fluids are necessary to maintain the blood pressure and prevent it from plummeting extremely low. Implementing extra IV fluids allows the nursing staff to control and track the amount and type of fluids given at certain times. Patients who are in shock and suspected of having sepsis should receive antibiotic treatment as soon as possible due to the inherent error margin. Treating sepsis patients rapidly can be difficult for doctors. They should concentrate on identifying individuals who can benefit from delaying antibiotic treatment until a bacterial infection diagnosis is made. Although there is still no established treatment for sepsis, the timely administration of antibiotics and IV fluids has long been the mainstay. The term golden hour of sepsis suggests a window of opportunity for optimizing these patients' safety and quality of care. The timely delivery of antibiotics has been the main emphasis of most sepsis treatment procedures. While some people may benefit from this therapy, others may experience adverse effects. How the organization collects and distributes data. The interview with my colleague, Chief of Surgery, Dr. Julie Broussard, described the process for collecting data and reporting it to the NDNQI. System reporting provides a consolidated way to compare and evaluate nursing quality performance throughout the system, including hospital and outpatient settings. Achieving consistent, better quality and coordinating care requires this all-encompassing strategy. Dr. Broussard also discussed how a system nurse executive can obtain a full understanding of each facility's performance to both national counterparts and the healthcare system by utilizing reporting analytics. Organizational leaders and the interdisciplinary team review the results every quarter. The conversation will center on determining the outcomes and tactics for improving quality to raise patient safety and quality of care. Nurses play a significant role in ensuring precise reporting and excellent results. The largest and most reputable group of workers in a healthcare industry are nurses, who operate in a variety of environments. In hospital environments, nurses play a critical role in providing patient-centered care that addresses a client's acute, long-term, and preventative medical requirements. The nurse must carefully enter all documentation into the electronic health record, which we know as the EHR, which the doctor will then review and possibly use to decide whether to take the necessary actions. Concluding thoughts. For the physician to properly prescribe antibiotics and fluids, nurses must document the patient's vital signs, medicines, symptoms, and follow-up assessments in the patient's computerized medical report. Sepsis not only negatively affects patients' well-being and their emotional state of mind, but it also affects the organization and healthcare professionals treating them. Quality improvement is a collaborative effort that ensures the provision of high-quality patient care. If nurses are not aware of the complete scope of their responsibilities, the quality of health care may suffer. As a new nurse, you must understand how quality indicators are instrumental in improving the care that is given daily. Nurses are on the front line of patient care because they are present at the bedside from admission to discharge. Nurses bridge the gap between quality improvement and positive patient outcomes by incorporating interdisciplinary collaboration, continuing education, meticulous documentation, and being an advocate for the patient. Thank you for attending this presentation.